There's a lot of takeaways from this year's ASH. I think number one, the clinical sessions and the plenary sessions show further evidence about the efficacy of immunological therapy as well as genomic therapy. I think that in particular the presentation that's going to be presented in a couple hours here today on Sunday about a FLT3 inhibitor for FLT mutated AML and showing an improvement in overall survival is very important. It's a very nice example of using targeted genomic therapy to improve outcomes in patients that have a challenging diagnosis. I think the other abstract that's being presented today, the plenary session, that's important clinically for all of the clinicians out there, is the use of rituximab in acute lymphoblastic leukemia. We've long known that rituximab improves survival in diffuse large B-cell lymphoma, but this is really the first large multi-center study that shows its efficacy in acute lymphoblastic leukemia, which is a challenging disease in adults. As I'm sure you all know, it's a disease that we generally cure in pediatrics, but in adults it remains a vexing challenge, and having an improvement is a big deal. You know, that's a good question. We think that the genomics are different in adults. We think that the whole biology of disease is different in adults. And we simply haven't had the same degree of success. It's a huge success story in pediatrics. And it's, unfortunately, more often than not, it's still a major issue for adults. Well, I'll be taking away a lot of things, but in two kind of big buckets. One, clinically. Number one, all the genomic information we're finding out about myeloid malignancies is really important. We do a lot of that work here at the Cleveland Clinic, but it's incredibly complex, and in different subsets of patients, genomic variations may be different, so making broad generalizations is challenging. Immunologically, I think the cool thing is there's a lot of new therapies that are being presented. As an example, a couple years ago here we talked about ibrutinib, which is a major advance in lymphoid malignancies, and there's preliminary data on the second generation Bruton kinase inhibitor drugs, which show fabulous promise, which I think is very, very exciting. And then in my role as a cancer center director, we're very concerned about healthcare economics and showing value. And ASH, I think, is at the forefront of trying to publicize the challenge of the ongoing cost of targeted therapies as we look towards bundled payments and reimbursement for what we do in hematological malignancies. The cost of pharmaceutical agents is a major challenge, and certainly something that society as a large in healthcare economics has to struggle with, and I'm very happy that ASH is at the forefront leading these conversations.